Hi, everyone. Welcome back. My name is Deanna, and I'm once again with Premier Behavioral Health Services. Today, I am so lucky to be joined by Alyson Phelan. Hi, Alyson. How are you?
I'm good. Hi, Deanna.
Alyson, you've been with Premier Behavioral Health for over 7 years.
hmm
And in that time, obviously, you've seen several different people within our area and focused on many different components of their life. But one thing in particular that you focused on has been traumatic loss and grief. And I think that that's a word that hits hard right now. I think that that's
hmm
something we hear. So, Alyson, can you please tell me first and foremost how you would define grief?
Sure. Grief is a reaction to a loss, and the loss doesn't necessarily mean the loss of a person. It could be the loss of a job, a marriage, a routine you're used to, which is really going on right now with COVID, or a loss of a sense of self, something that has to do with maybe a major illness like being diagnosed with cancer or a chronic illness like diabetes, and you just feel like you've lost who you were before.
And that's, I'm sure, something that so many are experiencing right now.
hmm
Now, if someone can identify that is in fact what they're dealing with, that they're struggling with at home, can you tell me and elaborate a little bit on what treatment specifically with you would look like?
Sure. So when someone comes in to Premier to see me about grief, I first kind of assess some feelings, what's going on for them. Grief often brings up feelings of sadness, anger, guilt, regret, fear even. And then I kind of get a gauge on what they're thinking about grief and their loss. So sometimes they might be struggling with getting back to quote unquote normal. Sometimes they think, well, if I do get back to normal, that shows I no longer care about the loss or that I don't miss the person or miss what I lost. And sometimes it's really just that struggle with getting new rituals in their lives.
And can you elaborate a little bit more on you specifically believe in the tasks of grieving, and
Yes.
that's something that probably a lot of people are unfamiliar with. So, can you elaborate a little bit more?
Sure. So one thing we're assured of is that everybody's going to at some point experience a loss in their lives. And it's just how impactful is that loss to them. And so the task of grieving are really four tasks, the frame that I follow. It's really accepting the reality of the loss, that the person, the job, the marriage, the routine, whatever, is just, it's gone. Then it's moving through, working through the pain and the grief associated with that loss and kind of confronting that. And then moving into adjusting to a life in the here and now, saying what is going on now in my life? How do I stay here present in this moment? And then maintaining connections in your life that you find to be beneficial for you. And a lot of that has to do with what we call loss orientation and restoration orientation. So loss orientation is kind of focusing on the loss, kind of really digging deep into that, perhaps reminiscing things that we're used to thinking about when we lose someone or something. Restoration might focus on, that you might feel isolated, but because of that, where you're starting to recognize that there's some ways that you can cope with what you're experiencing. And this isn't linear. This is something that you go back and forth between loss orientation and restoration orientation. So that's something that we work through in treatment to help people as they're going through those things. And we're always looking for, is this grief interfering with the way you want to live your life?
And that would certainly be a point in which someone
hmm
would need to see, a clinician such as yourself. So,
Right.
if somebody is struggling, if they can identify with what you're saying, how would they go about scheduling an appointment to see you?
Okay. So if someone is struggling with a loss, and they need to see me, they would just call into our office. Our front desk has very kind, compassionate people there on the phones, and they would be able to set up an appointment with myself or one of my colleagues.
Excellent. Thank you so much, Alyson. We really appreciate your time and your expertise on the topic. For anybody watching, if you are struggling or a loved one is struggling, please contact us. Alyson is certainly available, and as well as many of her colleagues, and they can be reached at 440-266-0770. Thank you again, Alyson.
Thanks, Deanna.